See none. The bill does enjoy a do-pass recommendation. Do I hear a motion?
Excuse me, Mr. Chair, are you going to allow for opposition testimony? I apologize. This is Jennifer Snyder on behalf of the California Association of Health Facilities.
We didn't have any registered, so.
I apologize.
But please, please go ahead.
Thank you. I apologize, Mr. Chair.
We do, in the future, please get your note to us, and so we can have you on our list. So, thank you.
Yeah, yes, we did. Sorry, Mr. Chair. Good evening, Mr. Chair and committee members. Jennifer Snyder, on behalf of the California Association of Health Facilities, which represents over 900 skilled nursing facilities and 400 intermediate care facilities for the developmentally disabled in the state. I want to first start by saying this evening we're extremely sympathetic with the local situation outlined by Assembly Members Marisucci and Santiago, and have appreciated both of them meeting with us and are very hopeful that we can be helpful to them in solving this very important district issue. Unfortunately, we must oppose AB279 today in its current form, because the bill would not just apply to the one intermediate care facility that's in Los Angeles, but would also impact all ICFs and all 1,100 skilled nursing facilities statewide. The bill would limit any changes to patient services, facility ownership, or other state-approved facility modifications that more often than not actually benefit patient care. We agree that the COVID-19 pandemic has been devastating for our long-term care facilities, their patients and their caregivers, and we agree that these times are unprecedented. We also agree it's important to keep patients as much as possible in their current facility locations. But the types of restrictions as outlined in AB 279 tie the hands of nursing homes throughout the state that are making decisions in the best interest of their patient safety and well-being. We've expressed support to the author's office and have provided amendments that would really try to push forward creating specific COVID-19 relocation plan requirements and state approval of those relocation plans. Unfortunately, AB 279 would inappropriately prohibit a closure or transfer of ownership for any nursing facility in the state during this pandemic unless they declare bankruptcy. And this restriction, along with a 6-month notice of change of ownership 1 year after the COVID-19 pandemic, would not only put patient care further at risk, but push the state into a costly bankruptcy process with debtors not being paid and patients not being properly cared for. So again, we're very much in agreement with the authors that the situation in Los Angeles could have been handled better and should have required more involvement and oversight by the State Department of Public Health. We do hope we can assist in finding a solution to that situation rather than create a statewide restriction impacting over 1,100 long-term care facilities and their 90,000 patients. Thus, we currently have to oppose AB 279, and I apologize for cutting in, and thank you very much.
Okay, thank you.
Excuse me, Mr. Chair, I apologize as well. There might have been some mix-up. I'm hoping to also speak in opposition.
Okay.
Thank you. I appreciate it. Good afternoon, Chair and members. My name is Alexandria Smith. I'm with Leading Age California. We represent more than 700 members across the state, including affordable senior housing, assisted living, and continuing care retirement communities, also known as life plan communities, as well as skilled nursing facilities. And our members serve more than 100,000 seniors in the state. First, I would like to acknowledge the author's goal to ensure that seniors are not displaced. We fully understand and are sympathetic with this concern, but unfortunately we have some concerns about the bill and the consequences for the senior care continuum. As mentioned, our members include continuing care retirement communities, which are multi-level retirement communities which have independent, assisted, and skilled levels all in one. Sites like these allow senior communities to enter into one campus or facility and seamlessly move through care as they age and their cares change. As outlined in support and in the committee analysis, we recognize transfer trauma and that it's well documented, and to the extent possible it should be avoided. The CCRC model that I just described accomplishes this, but unfortunately, this bill has potential to impact other care offered in these CCRCs. So if a multi-level provider chooses to close their skilled nursing for legitimate financial reasons, but must wait 6 months to do so or enter into bankruptcy, the other adults living in these different parts of the communities may also be displaced. While we don't believe that's the intention, such requirements would be detrimental to these residents living in these communities. In the past 12 months, skilled nursing facilities have endured a lot of financial costs, including PPE, private rooms, testing, and declining census. We are aware of at least one multi-level retirement community that chose to close their skilled nursing facility and appropriately transfer the skilled residents into, again, appropriate places. And we know of many others who are considering doing the same to, again, keep their independent and assisted living still up and running and not displace those folks. If bankruptcy were to happen, they would likely be able to force other adults out of their homes as well. And again, I'd like to echo Jennifer Snyder's comments, and we're sympathetic towards this local issue and what has happened in Los Angeles area, but we are hoping that we can consider other communities that might be impacted and not have to displace other seniors in the process. Thank you.
Okay, thank you. Now we'll bring it back to the committee. Do we have a motion or a second on this? A motion
second.
Motion by Ms. Aguirre-Curry, a second by Mr. Santiago. The motion is due pass as amended to appropriations. Gentlemen, would you like to close?
Thank you, Mr. Chair. I would just like to emphasize that while the original inspiration for this bill was what is happening at one particular intermediate care facility in Los Angeles and Assemblymember Santiago's district in Boyle Heights, the Sakura ICF, which is in the process of transferring their residents to one of their nursing homes, the CAHF Los Angeles, also in Mr. Santiago's district in Lincoln Heights, which has suffered the highest number of COVID deaths among any nursing homes in the entire state. And so that's just one example of what we're trying to prevent through in the entire state of California for residents to be transferred or evicted during this pandemic. It's the humane thing to do. It's the right thing to do, and I ask for your support.
Thank you very much. The bill does enjoy due pass recommendation. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mays? Mays not voting. Aguirre-Curry? Aguirre-Curry, aye. Bigelow? Bonta? Bonta, aye. Burke? Burke, aye. Carrillo? Flora? Flora not voting. Mainshine? McCarty? Nazarian? Nazarian, aye. Chu? Rodriguez? Rodriguez, aye. Santiago?
Aye.
Santiago, aye. Waldron? Waldron not voting. 7-0.
Okay, thank you. The bill has 7 votes. We'll leave it on call. Thank you. I just want to say, we do have time frames for witnesses to register to testify. So I was surprised, and we don't believe we have a record for the last 2 opposition witnesses. We told other authors, we told other witnesses it was past the time, and for them to register as witnesses. Just a note: for the next 2 hearings, if you miss the deadline for registering as a witness, whether you're in support or opposition, you will be allowed to support or to make your case only as a Me Too in public comment, stating your position on the bill. So, in fairness to the people who did, we did have everything all lined up. I think it's important that we honor that, and so next 2 hearings we will be very strict about it. So I apologize for that, but if you want to be a witness, get it in time, and double check with us and make sure it's been received and that you're counted. So thank you.